Hello, and thank you for joining today's webinar. We will be starting the webinar in 3 minutes. Hello, and thank you for joining today's webinar. We are ready to begin. Today's webinar is eligible for 1 contact hour. Sigma Theta Tau International Honor Society of Nursing is accredited as a provider of continuing nursing education by the American Nurses Credentialing Center's Commission on Accreditation. The speaker and planning committee members have disclosed no conflicts of interest. To receive contact hours for this CNE session, participants are required to attend the webcast and complete the evaluation form, which will be emailed to all attendees approximately 1 day after the webcast. The webinar is being recorded and will be available via the Sigma repository within 10 business days of recording. Following the presentation, we will have a question and answer session. You'll see on your GoToWebinar control panel that you can send a message through the questions feature. This is where you can type in any question you'd like to pose to the presenter. Be sure to hit send so that the message makes it to us. We would like to thank our speaker, Dr. Polly Masnick, for sharing her expertise with us this evening. Now I'll turn the presentation over to her.
Thank you and good evening. It's a pleasure to be with you tonight, and certainly an honor and privilege to be speaking to all of you who are on the front lines out there doing such amazing work during this coronavirus crisis. I realize many of you who I'm speaking to tonight, we were all planning to be together for the Sigma Theta Tau and NLN conference that was supposed to be in Washington, D.C. these couple of days. So I'm disappointed that we can't meet face to face, but I'm very grateful for the privilege of being able to speak with you tonight. I am the research associate professor at FPB, Case Western Reserve School of Nursing. And in addition to that, my role is the ELNIC project director for undergraduate and graduate nursing education, and I'm responsible for the curricula that we put together for schools of nursing. You'll be noticing that a lot of what I will be sharing with you tonight are materials that come from our work in ELNIC. That group, as you know, is responsible for preparing nurses to be able to provide primary palliative care education to patients who are seriously ill. So it's so appropriate at this point in time and this evening to share some primary palliative care principles with you. I'd like to begin by taking a moment for us just to sit back, and I'd like you all, as you look at this slide, to think of 3 things today that you've been really grateful for. We've struggled with all that's going on in the news that we're getting and the hectic pace at the clinical settings that we are practicing in, and the distress that we're experiencing. But it's so important to think about all the good things that are also going on. So I'm going to give you a second to just think about this past day, the practice that you've done and the work that you've done with your patients and families, with your colleagues, with your own families and neighbors and communities, and think of 3 things that you are really grateful for. I know the silence is probably a little uncomfortable and you're wondering, is my program working? Yes, it is. We wanted to really lay the foundation for how important it is to have a positive attitude in the midst of this crisis, and to be able to think about the things that are going well and to focus on those and certain things that we can be grateful for. Could I have the next slide, Megan? Thank you. So tonight, together, we're going to look at the current evidence regarding the COVID-19 virus, because knowledge is power. There's a lot of misconceptions out there, and we hear every day stories from people of things that are not even accurate. So it's important to think about what are the facts, and then we're going to discuss the ethical dilemmas that are facing us as we care for patients who are seriously ill, excuse me, with COVID-19 and their families. We're going to, after looking at those dilemmas, we're hopefully going to have the strategies then to address these dilemmas that are facing us in this unprecedented crisis. I've been a nurse for over 40 years, and I don't know that I've ever seen anything quite like this. And then most importantly, we're going to talk about some self-care strategies, one of which we just did a minute ago, that'll help support us as we deal with the moral distress that is bound to come from this crisis. Next slide. So to get us started, where are we today with the coronavirus? Let's look at the update. Next slide. It's so important, as I said earlier, to keep up to date with evidence-based resources. We heard lots of rumors, and we want to dispel those tonight. I want to encourage you to use the resources that we've listed here as some of the greatest websites to go to for the latest updates and the most accurate up-to-date information. Certainly coronavirus.gov, which is the CDC website, is probably one of the easiest to access. Bookmark it so you can quickly get facts and figures. They give us the updates in terms of things that we as healthcare professionals need to know, as well as the site is available for the public so that they know and reinforce the importance of the critical measures that we're taking to mitigate the virus right now. But our own ANA has a great website. Our SIGMA has a great website, and AACN, American Associations of Colleges of Nursing, also provides us with some updated information. So make sure that you are keeping up to date with the facts. One of the ways that we can take good care of ourselves is not to watch too much on the news, because it can be overwhelming, but going to these quick websites will give you a snapshot of what's going on today, because they are updated daily. Next slide. So what do we know? Well, we certainly know that this is a global pandemic. It's spreading rapidly through many countries, and what started in China is now, gone around the world. We know that the spread is thought to be through aerosolized droplets. Most of those that come from coughing in particular, but also sneezing and even breathing. We know that the incubation period is unfortunately long, 2 to 14 days. Part of the reason why so many people are quarantined for those 2-week time periods. And then the symptoms typically are fever, cough, and shortness of breath, and that's what we're telling the public. But it's very concerning that there are people out there who don't have any symptoms and are, in that incubation period and can spread the virus in the absence of symptoms. We also know it lives on plastic and metal for up to 72 hours, so we have to be meticulous in our cleaning of everything that we are in contact with. We know that the risk is much greater for older aged adults, especially those who have comorbidities. And the people that are doing the poorest are those who are over 85 and have multiple comorbidities. There have been less instances for children, which is fortunate, but we are hearing some cases that have arisen, typically with comorbidities. Next slide. So what do we know about what we should be doing in terms of best practices? And this is taken from Journal of American Medical Association last week, and also from the CDC coronavirus website. And I don't think anyone would be surprised that, the recommendations for everyone are strict hand hygiene. That's in the public as well as in the healthcare facilities. Aggressive surface decontamination, because we talked about its ability to be on plastic and metal, social distancing of 6 feet, and no more than 10 people in a group, although that's changing day to day. I did these slides 2 days ago, and there's in my own state of South Carolina, we are now told no more than 3 people in a group, and that was as of noon today. Our healthcare system recommendations. What do we need to know to do? Well, the patients that come to our institutions that present with symptoms, they need to have a face mask on arrival and rapid triage. Ideally, separating them in well-ventilated space with 6 feet distance, and getting an isolation room as soon as possible if it is available. I know my colleagues that are out in New York State, Washington, and California, where the virus is the most virulent, you are having challenges with availability of rooms, et cetera. And you'll do the best that you can do, but this is the ideal. And also recommendations. I'm sorry, could you just go back? Recommendations for our workforce. If you are in contact with infected individuals, we really know that it's so important, obviously, to do the hand hygiene and the decontamination, but PPE is huge. And that is going to be one of the moral distress issues that we'll be talking about tonight. You need to have gown, gloves, and an N95 respirator. It's important to have face shield and goggles, and if you don't have that, maybe a powered air purifying respirator, if that is available. The issues around the N95 respirator in some institutions continue to be a concern because we know that there has been a fear of a shortage, and in some instances there has been limited access to the supplies that we all need. Next slide now, thanks. So the current statistics, well, they're not quite so current because you can see the dates on those. It gives you a sense of the global aspect of this illness, and Italy, our colleagues there have been really suffering, although we're hoping to see the curve come down a little bit now as they're reporting less new cases and less mortality. In the US today, on the cdc.gov update, which is done every day at noon, the cases that had been 35,075 3 days ago are now up to 54,453. And we know that some of that is because we have more testing available. So we expect that as more people are tested, we're going to have more positive um, results. And then the number of deaths have gone from the 458 3 days ago to 737. The percentage of mortality has not changed. So we know that we are on the upswing of this curve, and you are all on the front lines dealing with this every day. Next slide. So what can we draw on? Do we know anything about how to deal with the pandemic? Some of us have lived through the AIDS epidemic that in the 80s, and that was certainly a frightening time as well, but different than this. Many people have lived through influenza pandemics because we know that influenza is very deadly for especially our elders or people with comorbidities. And our colleagues, Downer and Zechariah, that I have listed here from 2010, have been able to share with us, at that time, some ideas about how to deal with a pandemic. And these hold true today. We have an obligation to provide good symptom management to everyone when we're dealing with a pandemic. We may not be able to save everyone, but we certainly want to make sure that we are taking great care of everyone. In the midst of doing this, we know some will maybe not be offered the opportunity to have potentially life-saving therapies in a triage system. That was true in 2010, and it's true now. We also know that families may lose the opportunity to be involved in decision making. Things happen so rapidly, and the disease can be so aggressive that families may not have as much opportunity to be involved in decision making, and certainly may be affected by the triage system in terms of the outcomes for their loved ones. And most concerning, certainly from our perspective in palliative care, is that for the first time, patients might be forced to die alone, and this is really frightening. We're seeing this happen. They are isolated. Families may or may not be able to be with them, depending on your own institution's restrictions, and this is quite distressing. We have to come up with a plan to improvise, that is something that is just way too devastating for not only the patients, but also the families, and for all of us as healthcare workers who hate to see that happening. A pandemic stresses the frontline healthcare workers. That's all of you. I know that's happening right now. I've heard from my colleagues that are on the front line. Workers are being asked to work in unfamiliar areas. A pediatric nurse might be sent to an adult area where there's a huge shortage. We know that workloads are exceeding the normal limits, and that shifts are sometimes much longer than anticipated when you first start out. And the big worry for all of us are that resources and supplies are limited. This was true in 2010, and it's ever true now. And the result of these stressors are burnout and PTSD that can happen to our healthcare workers, and in particular to our nurses. And we're here tonight to try to support you to find creative ways to avoid that from happening. Next slide, please. We said we wanted to talk about the ethical issues that are facing us. And when we look at ethics, so certainly from our colleagues that have studied pandemics, a number of years ago, we certainly have a responsibility to protect the public from harm. So we as nurses who do a great job of education are sharing with our neighbors and friends, and certainly patients and families, the importance of social distancing and the importance of making sure that we respect that 6-foot social distancing, especially at a time when we're so used to responding by wanting to hug each other and be close to each other, and yet we can't. What about proportionality? Making sure that there's enough for everyone. It's an ethical issue, and we're seeing PPE and equipment and ICU beds that cannot be hoarded within the communities. We've heard some stories, unfortunately, of some institutions that have been hoarding equipment, and yet we are hearing many, many, many more positive stories of institutions sharing everything that they have with their sister institutions down the street that might have limited supplies. And we're hearing about some of our other healthcare providers like dentists and veterinarians and our nursing schools offering to give up equipment that they may have in their labs or in their offices in an effort to help the institutions that need them. We have a duty to provide care. We entered this nursing profession, we took our oath, we promised to never abandon patients and their families. But yet we have to balance our obligations to protect our own health and our own families with that of our professional duties. So in thinking about that, if you're out there listening and you have multiple comorbidities yourself, or you have family members who have very serious comorbidities living under your roof, you need to talk with your supervisors about making sure that your assignment is appropriate, and that although you want to provide care, I know that you're all committed to be out there and helping others get through this. We also want to make sure that you're protected and we're balancing your needs with that of our professional duties. What about equity? We want everybody to be able to have everything possible in terms of surviving this illness. Many patients may not survive despite the technology we have, and some patients may not have the availability of the technology due to triage issues. But keep in mind that all patients still need care. We can still do something for everyone. We may not be able to save everyone, but we can still care for everyone. And the ethical issue of trust, our patients and families and communities are looking to us to give them honest answers, to help make clear decisions and help make decisions transparent. They remember that they have noted that we are the most trusted profession for many, many years in a row. And in 2020, again, this came to pass. They are looking for us to communicate honestly. So we want to be truthful about what needs to happen and make those decisions transparent in a compassionate way. Next slide, please. So these ethical issues, we've got to protect the public, which is, do no harm and do good, non-malfeasance and beneficence. We want to do this protection by, certainly respecting and role modeling and educating about social distancing and following the CDC guidelines. Go to that website and hold that as your evidence of what you need to do to protect the public. What about proportionality, that ethical issue, and justice? We want to avoid that hoarding mentality, but in doing so, we can develop some creative solutions to the concerns that we have, especially those around the shortage. When I was reading this Annals of Internal Medicine article that was posted a few days ago online, it was nurses that sometimes came up with some really creative solutions to what do we do if we run out of PPE. And snorkel masks was one of the things that came up as being possibly something that if you're really stretched, this could give you some protection. We can call on our other Americans to help us, and some of them are painters or contractors, workers that can donate particulate filtering masks that maybe they don't need right now when we are in such need. And as I mentioned earlier, our other healthcare professionals like vets and dentists that can donate some of their masks if they're not using them. I'm so impressed to hear the number of nursing schools that have donated all their things from their labs to their partner hospitals. Other ideas that came up in the annals were considering sterilization. It takes about 12 hours, and that would be of the N95 masks. It's not clear that the evidence is strong enough in that, but it's a possibility. They're also looking into decontamination with UV germicidal irradiation. The only issue there is, that some of the straps may be damaged by the irradiation and they may not give us the same tight seal, but they're looking into that. And another recommendation was maybe wearing a surgical mask over the respirator to conserve the respirator but prevent droplet contamination. And I loved the one recommendation that nurses came up with. How about putting infusion pumps outside the rooms if that's at all possible and safe, with extension cords that limit the room entry and thereby limit the need to put on new PPE every time you go in. So, coming up with strategies to be creative in the shortage of things that we're running out of. Nurses are doing a great job with that. Next slide, please. What about the duty to provide care? And again, I mentioned, to balance your professional duty with your own health and family's well-being. You can't care for others if you don't take care of yourself. And that's not just the physical well-being, but it's also the emotional and spiritual well-being. You've got to be strong in mind, body, spirit to be able to deal with the challenges of this pandemic. And certainly think about your colleagues. If you have staff that are at increased risk, limit their exposure, be a leader, make sure that you speak to your supervisors and, let them know that maybe one of your team members shouldn't be the one to take care of the 2 new patients with COVID-19 because they are at increased risk. Keep in mind that in China, they did have infected healthcare workers. So they had an estimated 3,000, and of those, 22 died. So we have to take this seriously. And then what about beneficence also in terms of equity? We want to make sure everybody is getting care. They may not all get technology, but they can all get care. And if you have access to palliative care teams, please draw on their support. They can help those that are critically ill, especially those that are not expected to live. And they can also help you all. Part of the palliative care team's role is to support the other caregivers, the healthcare providers, and so they can be a tremendous support to you. Keep in mind that we do need to have a plan for those who are dying, not just those that we are hoping to save. And you can see the data from China that was reported. Certainly the number of those who needed hospitalizations, 5 to 15% of those that were hospitalized died, and 22 to 62% of those who were critically ill and hospitalized, mostly in the ICUs, also died. So we need to come up with a plan to provide care for all. And that might be your role as a leader on your unit to make sure that those who are not getting some of the invasive technology are still getting aggressive care. Next slide, please. We need to do all that because we want to be able to survive in the midst of these challenges. This is not an easy time. And we're at great risk for compassion fatigue, for burnout, PTSD, and moral distress. I don't think it would be any surprise to any of you that those of you out there on the front lines are witnessing triaging of equipment to those who have a chance to live. Not unlike Sophie's Choice, for those who remember that book, just so difficult to make that decision. And how do you respond to those patients and families who have questions about that? We're going to be witnessing patients who are dying without their family able to be with them due to visitor restrictions. If there's any way we can advocate for change with this, keeping in mind the safety of the public, we certainly want to do that. If there's any creative ways using iPads, iPhones, etc., to help make that connection so that family are able to, quote, be with their loved ones, let's do that. Certainly during this crisis, we're going to experience cumulative loss like we've not seen in a long time. It won't be unusual as the cases increase and the mortality increases as we, although we're trying to flatten the curve, but as that curve is rising, we're going to see that cumulative loss, and it can lead to compassion fatigue for sure. We're all suffering from exhaustion due to heavy workloads, schedule changes, juggling not only your workload at work, but many of you who are parents or caregivers of your own parents, if you're trying to provide care to them at home, plus homeschool your children because they are no longer in schools in session, you are going to be exhausted. And certainly we all struggle with worry about exposure, as we mentioned, the importance of balancing our obligation with safety. And critically, we're all witnessing the angst already over limited supplies, numbers of ICU beds, the equipment that is needed, and certainly the PPE. Next slide, please. So how do I know? Is it compassion fatigue? Is it burnout? Is it moral distress? Just to give you, a framework for what those are, I think as you look at the definition of compassion fatigue, many of you may already be feeling some of this with all that's gone on in the past couple of weeks. It is the physical, emotional, and spiritual result of chronic and continuous self-sacrifice and or prolonged exposure the past few weeks to difficult situations. It's so hard. You might even be unable to empathize with others as you are experiencing this compassion fatigue. And what about, how does that differ from burnout? Burnout is physical and psychological with a decrease in loss of motivation. You just can hardly do it anymore. It's not so much that it's just difficult to do it, you just don't know that you can do it. And it's typically triggered by the increased demands, the lack of resources, the stressors among each other as you're struggling with all the limits that are out there and the organizational policies that may really be causing you some angst. Next slide, please. And moral distress, which many of us might be experiencing, is certainly the result of having to act in a way that is in direct opposition with our own values and beliefs. We typically see this in the care of the seriously ill in palliative care when we are witnessing unrelieved pain or suffering, or we're seeing inefficient healthcare systems. And in the COVID-19 pandemic, seeing the limited availability of equipment, and certainly the concerns of triaging for some patients and equipment not for others, ICU beds for some patients and not available to others, is in opposition with our own values and beliefs and can cause intense moral distress. Next slide, please. We can be resilient. We know that there is a lot of literature out there on the importance of moral resilience, especially in nursing. We want to be able to have the ability to be buoyant in adverse circumstances. And boy, that's never needed more than now. And we can do this by finding meaning in every circumstance and in every day and in every experience. It will help us manage some of these moral stressors. Next slide, please. So how do we start cultivating moral resilience? Well, there's lots of ways to do that. We can certainly begin by being very self-aware. How am I today? Do I feel strong? Am I able to take this on? Can I tell myself that I can do this? I can rise above these circumstances and do the best care possible. We need to develop self-regulatory capacities. We need to be able to balance self-care in the midst of huge demands at work and at home. We need to continue to grow our ethical competence. I think nurses are so ethical in their practice. They're educated to be ethical, compassionate nurses, and we want to continue to grow that competence in providing care that is just, that is proportionate to, and is certainly benevolent. We want to be able to feel that we can speak up with clarity and confidence. Some of the ways to do that is to go to the websites that we gave you earlier in terms of being knowledgeable about what's going on with this virus. Be able to share the truth. And if you can find meaning in the midst of this despair, there is some in every single day. We have to look for it. Engaging with others is a challenge because we have to keep that social distancing, and that's different than what we've typically done in the past when we've been trying to cultivate moral resilience in the midst of challenges. You know, it wouldn't be unusual to have a social gathering. It's part of our culture to feed each other and to have a meal together. We're not able to do that in the midst of this virus, but find ways that you can engage with others. It might be now posting thank you notes or messages of affirmation on bulletin boards at your institution or your clinical site that you're practicing in. Continue to connect with each other. And then certainly anything you can do to participate in improving your knowledge, especially in providing primary palliative care to all these people with serious illness. Now is the time to do that. And our LNIC curriculum is available online for anyone who needs some extra support. You can email any of us and we're happy to help you. And then certainly do our part as nurse leaders to contribute to a culture of ethical practice, especially in the midst of some of these ethical dilemmas. Next slide, please. So what can I do if I'm a nurse and I'm struggling? Well, Sigma tells us all nurses are leaders. The nurses at the bedside are leaders. So take that role on and lead the way. If you're having trouble, if you find you're crashing, you feel like maybe I do have some compassion fatigue, or I'm burning out, utilize your employee health counselors for personal support. I'm sure they're stretched at every institution, but they are there for us. Call on them, let them know your needs. Certainly, your ethics committee members, if you're at an institution, might help you debrief about ethical issues that are taking a toll on you and your colleagues. Maybe there's a way to have a 15-minute session before the start of a day and have a committee member with your staff to talk about an ethical issue that's really bothering you. Encourage discussions around staffing fairness to limit the workload stress and to recognize the importance of making sure that the workload is distributed fairly and that those who are at highest risk with comorbidities have the least amount of exposure to the patients who are seriously ill. Most importantly, find ways to celebrate successes and joys. Even in the midst of this pandemic, there are always joys to be found. Might have to look a little harder for them and might have to be a little more creative in ways to celebrate them. But lead the way in your institution, in your setting, and find something to celebrate. Certainly, if you're struggling with things like incivility or bullying or workplace violence, you know, look at the tools. ANA has a great number of resources available, as does Sigma, strategies to help you if you're experiencing this. It's always our hope, and certainly something that we are seeing nationally, people rise to the occasion in the midst of a pandemic and do their best. but there are always some people, there will be a few who aren't able to rise to the occasion and might really act out in the midst of the stress on themselves. So be aware of that. Access resources if you need to use them. And again, I keep telling you, education is power. Seek the facts and whatever you need to be able to prepare you to feel confident in delivering the care that you want to deliver. Next slide, please. Other things that you can do, and looking at different wonderful emails that have come across my desk from many different nursing organizations about ways to address compassion fatigue and burnout and moral distress. There are so many different ideas, and I'm sure you have more, and I hope you will share them tonight online during the discussion and question and answer period if you have some. But think of things that you can do to help, and consider appointing a wellness champion on your unit. Maybe someone who's going to take responsibility to remind everybody on your team to take care of themselves physically, psychologically, and spiritually during this difficult time. One of the things that I know we often did at our cancer center and university hospitals in Cleveland and with our palliative care group is that we started every day before we gathered for our morning report, or however you might be doing that now, again, being respectful of social distancing. But we started with something, either a saying, a word of the day, a prayer, or some sort of special saying that would bring meaning to everybody, brought everyone together, even though you have to stay physically apart, and launch the day with something positive. There are so many great affirmations out there. You can Google them online, and what a wonderful way to put everybody ready to start the day or start the shift with something positive. Try to remember that nutritious food is critical at this time. This isn't necessarily the time to bring boxes of donuts in if you have donut shops even open in your communities. It's hard because eating is a social expression of caring in our culture, but maybe there's a creative way to bring some single package items in that everyone can enjoy that are nutritious, like nuts. Another thing that happened just in our own community yesterday, was that one of our community hospitals put out a call on our community website saying the nurses were really struggling and exhausted and had a craving for oranges. Could anyone bring oranges? They were inundated with crates of oranges dropped off at the steps of the institution. The security guard came out and brought them in. Don't hesitate to call on your community to help you maybe provide that nutritious food, because the public is wanting to do something to help our heroes like you during this difficult time. And please make sure you and your colleagues are taking breaks during your busy shifts. This is not the time to try to go through the whole day without eating, or heaven forbid, without going to the bathroom. Why do nurses think that they can, not have to pee during the course of the day is beyond me, but we still see some of that happening. And it's so important that, role model taking those breaks so that your colleagues feel comfortable doing that as well. Next slide, please. I'd like to share with you a really creative strategy that might help protect you, especially when we talk about cumulative loss. It's very difficult when we do everything we possibly can to try to save someone who is actively dying from a horrible infectious disease that we wish we could control better. And it can be overwhelming when you experience multiple losses. Keep in mind that you are not the reason this patient died. It is the coronavirus that is the reason the patient died. You and your team are doing everything possible to help them survive this horrific pandemic. This little YouTube, it's just a couple minutes long, and I wanted to share it with you tonight so that you could share it with your colleagues. It's easily available, obviously, online, but it's been developed by a nurse, of course. His name is Jonathan Bartels from the University of Virginia. He recognized the need for the pause, as you'll see in a moment. And it helps not only honor and respect the person who has just died after valiant attempts to try to save him, but it also gives the staff an opportunity to grieve the loss so that you aren't burned out and overwhelmed by cumulative loss. So if we could just show this little video, I think many of you may have seen it, but for those of you who haven't, share it with your colleagues. It is so powerful.
Good pulses with CPR. You getting tired at all? Epi's in. That's the 5th dose of Epi since the vasopressin.
He's still in asystole.
How's he bad? He's still rich.
Let's stop CPR for a minute. He doesn't have a pulse or audible heartbeat. Is he assisting at all?
No, he's making no respiratory effort.
We've been at this for 30 minutes. Does anyone else have any other suggestions? Let's stop. Let's call the time of death 9:30.
Okay, everybody, can we just take a minute for a pause? This was somebody's father, somebody's husband, somebody's friend. This is part of our mission, to know me, care for me, ease my way. Let's take this time to honor the fact of this person being here with us and also how hard we tried to save him. Let's just take 30 seconds and honor him.
Thank you for all your efforts. Has the family arrived yet? We'll go get them.
Thank you, Megan, for making that possible to share with everyone on this call. Every time I see it, I'm so moved by it. Of course, they aren't covered in PPE because this was not done during the coronavirus crisis, but you can see that moment of being able to honor and respect the person who was lying there before them, as well as grieve that loss and appreciate all that they had done in an effort to try to save him. Just something that might be helpful when you're going through, especially those of you in the ICU in the emergency room, struggling with those who are critically ill and may not survive. Next slide, please. So, protecting yourself through this crisis, you need to lead the way. As I mentioned, be that role model to the rest of your colleagues as how to, do that self-care. Self-care does not mean selfishness. You can't possibly take care of others if you don't take care of yourself first. And we tell all of our family caregivers that when we're teaching them about how to care for their loved one, yet we don't always listen to that advice ourselves. So please try to Be proactive, do self-care. We know what that means. Balanced nutrition, a realistic exercise plan. You may not be able to do what you normally do because the gyms are closed in the midst of this crisis, but find something that you can do, whether it's a walk outside or an online exercise program through the gym that's closed, or any of the online YouTubes that might give you an opportunity to get that physical exercise, because that will help your mind as well as your body. And you've got to get enough sleep. Difficult to do when you're working long shifts and juggling family, etc. But quality sleep is critical. And for spiritual well-being, you've got to find a way to engage in activity that brings you meaning, even if it's for only 10 minutes of the day. Maybe some of you really love reading. Find that book that you can work on that gives you joy. Or if you are someone who loves to sew or knit or crochet, set aside 10 minutes a day to do that. If you can get out into the outdoors and you're not on intense restrictions within your community, appreciating the outside can give you tremendous meaning, either watching walking through the woods or watching the seasons change into spring. I know that's so beautiful here in South Carolina. Pay attention to your body signals, respond to the needs that the body is telling you, and listen to it, and try to create positive emotions. We started this whole session out by finding and expressing gratitude. Doing that every single day will help you emotionally and spiritually. And if at the end of every day you can write down 3 things that went really well during that day, as well as an affirmation, a positive affirmation to keep you going, it's critical to do that. And it only takes a couple of minutes. An example of an affirmation, an I statement that will really help you with your emotions, especially when they seem to be slipping onto the negative side. Say things that are positive to yourself over and over, like, I've been given endless gifts and talents, which I will use today, or which I use today. Remind yourself, I possess the qualities to be resilient. And tell yourself your ability to conquer your challenges is limitless. You've got to reframe what's going on in an effort to be able to handle the challenges that you're going to face every day on the clinical settings. Next slide, please. Stay safe and stay healthy. It's very hard, especially with social distancing. Try to utilize technology to stay connected. I know so many people are doing that, whether it's putting everybody together on a Zoom meeting or using FaceTime. I know so many of those technologies are being offered for free to people so that we can all stay as healthy as possible. Reach out to elders or others in need in your own neighborhood. Let them know that you're here if they need something. They're lonely too. And consider meeting with a group of friends. I had a colleague who just the other day, they did yoga together, and it was just a great experience. They had a lot of laughs and fun, and doing it on Zoom wasn't the same as being in person, but it was great. Look for those videos online that you can use, certainly to substitute your gym time, or look for online church services or prayer groups that are available. They are popping up every single day where you can go to get some spiritual strength, and take advantage of the outdoors. I can't say that enough. I know some of you may be in cities where you're not able to get outside, but if you can even look out your window and notice the trees changing. I can remember when I was in high school, and that was a long time ago. I had an English teacher who made us go out every single week into the woods and write a whole 1-page paper on how the trees changed during the course of spring. I thought he was crazy. What could you possibly write week after week? And I've never forgotten it ever since then, because you are able to see those little blooms, those little buds grow, and that rebirth, that new life, it changes certainly every week and sometimes even every day. And take advantage of what's right outside your window to maybe give you some additional strength. Next slide, please. So let's just take a moment together as we're coming to the end. Put down your pen if you've been taking notes and center your body in your chair. I want you to close your eyes, and we're going to do a very brief relaxation exercise. This is a 2-minute exercise that hopefully, if done, on a regular basis or at a time when you feel like everything is crashing down on you, will give you strength. So sitting comfortably with your back straight and your eyes closed, begin by focusing on your breath and feeling the air going into your body and then leaving your body. Feel the air traveling through your nose as it goes in and then comes out again. Whatever your breath is doing, just watch. Notice how it feels. Feel the movement of your body as the air goes into your lungs and then out again. If your mind wanders off to other thoughts, just bring it back and focus once again on your breath. Just feel yourself breathing. When you're ready, you can open your eyes. You can Google any of these mindfulness relaxations online. They range from something like this, which is just a 2-minute breathing exercise, to something much more extensive. But I know right now, when you're so stressed for time, the last thing we want to do is ask you to do something that's going to make your stress worse. So find some sort of a relaxation tool that you can use daily and that you can have in your pocket when things are crashing around you, to take just 2 moments to gather yourself. Next slide, please. On behalf of my colleagues on the ELNIC team and all of Sigma, who has been so supportive of putting these webinars together for all of you, I want to thank you for everything you are all doing, for your patients, your families, your colleagues, and for your own communities. You are heroes. And I think that there is not a question in my mind that each and every one of you has made an impact on someone and some family members every single day with the care that you're giving. We thank you all. And with that, I think we have a few minutes for questions and discussion. The slide that follows this is just some references for you that are, if you need to access them, but I would encourage you, certainly if you have major questions about COVID-19, to go to the websites we gave you in the beginning. And some of the articles I referenced are on that reference sheet. So Megan, can we open it up? Are there any questions?
Polly, I do have a few questions for you. What are your recommendations for nurses dealing with conflicting information regarding PPE?
That's a great question. Again, as I said earlier, there are so many rumors out there. It only takes one person to start one that's going to scare everyone in your clinical setting. I think the fear is real. We certainly have heard that from Dr. Anthony Fauci and certainly from the CDC. The plans have been put in place. Every day we hear more and more about millions of parcels of equipment, whether they are masks or gowns, gloves, etc., are being shipped, in particular to the most needy states and the hot spots throughout the country. I would encourage you all to share the coronavirus.gov website with your colleagues, because there is a healthcare link there for professionals, and it does give you updated information that is accurate. As I mentioned, it's updated every day. The fear is real, but the rumor mill is horrible. So know that the supplies are coming. Hopefully the hot spots are certainly the ones who need them the most and are getting them right now. And again, some of the creative solutions I shared with you that I read in JAMA and the Annals of Internal Medicine, many of them were started by nurses. And so be a leader in your group and see if there's something else that you can do to makeshift masks, etc., for scenarios where patients are not infected and putting you at great risk. The N95 should be safe for people with coronavirus and the health caregivers that are caring for them.
Polly, how should nurses handle conflicting research, such as the coronavirus being on surfaces for up to 17 days?
So again, I would encourage you, I gave you a 72-hour time frame. There are some stories out there of it lasting longer, and again, people are doing a great job of trying to decontaminate doorknobs and metal and plastic and everything possible. But I would encourage you to only go to those sites that have the national evidence, and those include the CDC and the NIH. Personally, I find Dr. Anthony Fauci from the NIH to be brilliant. He has been with us through many different horrific experiences like the AIDS epidemic, and a brilliant immunologist, and is doing everything he can to get the evidence out there to all of us, especially the healthcare providers, so we know what is true. And new data comes in every single day. This is unprecedented. We don't have all the answers, but we're doing the best we can with the data that we get, and getting that data out to you through those evidence-based websites.
At the conclusion of our webinar, I want to share a comment from an attendee. This is the best piece of advice that her preceptor gave her. As a nurse, it's okay to cry, as long as you know you will need to let it go after that.
Oh, thank you for that comment. And, absolutely, it's okay to cry. It's absolutely okay to have meltdowns. We can't possibly do this work without having those moments. I hope we've given you the tools in this webinar to give you strength when you need it. But this is a tough time for everyone, and it's certainly okay to share your own struggles, your emotions, reach out to your employee health people, listen to your body signals if you think you're getting into trouble, especially in terms of mental health, and act on that.
Polly, I have another question for you. How do you suggest we respond to angry family members?
That's a great question, and that's very loaded. We are going to be having a webinar tomorrow on communication, same time tomorrow night, and we will be certainly addressing some of those issues that are coming up with people that are, family members that are incredibly angry. They may not be able to see their loved one. They may not be happy with the decisions that are being made for their loved ones. We can only honor and respect their emotions, and, validate that you are hearing that this is a really difficult time for them, and we can't possibly know how they feel. You never can know how it is for another person in their shoes, but you can respect the emotion, accept that this is, a really difficult time for everyone, and be there to let them vent. Sometimes that's hard when you really have limited time, but it's all about the power of presence, which we'll talk about tomorrow, being able to listen to them and being able to allow them to vent and be respectful of their emotions.
Polly, I have a few more questions for you. How should we handle requests to reuse N95 masks or take care of patients without N95 masks?
I would again say that your institutions need to be following the CDC guidelines with use of the equipment and what's appropriate in terms of safe practice for all the healthcare providers. For taking care of patients with coronavirus, it is absolutely critical that you have a respirator. There are some ways they have not been tested as well as we'd like them to be, to use face masks over the N95 so that you can maybe preserve those N95s for longer and, quote, reuse them. But we don't have data to let us really know how safe that practice is. So first and foremost, we want to follow the guidelines. Secondly, find ways to get masks to your institution. Call your vets in the area, call your dentists in the area, partner with your nursing schools, find creative ways to get some of those pieces of equipment brought to you while you're waiting for the federal government, who's also working very hard to get deliveries, especially to the hotspot areas. And continue to go once a day to that CDC website to look for any evidence as they continue to study ways to use other forms of equipment, like the scuba mask that one nurse creatively suggested was powerful protection for eyes and mouth and spread of droplets.
Polly, for nursing students graduating in May, how can we prepare to begin practicing in the middle of a pandemic?
Well, my heart goes out to all of you. I know there are so many questions about you trying to finish school, getting your clinical hours in, working with your own institutions, your schools of nursing to make sure that you graduate with your competencies in place and get prepared to take the NCLEX, whatever that will look like. I think this is a really difficult time. I would encourage you all to find a mentor wherever you are going to be working. Find that person who's going to be able to support you, because this is a time like no other, and you can't do it alone.
Polly, one last question. Are there any tools you would recommend for self-awareness tools of compassion fatigue or burnout?
There are so many things out there available, and I guess I would just say that our ELNIC colleagues are on our ELNIC website. We are putting together a COVID-19 page, and the first thing we are putting up is information about self-care. So I hope that you will be able to find those tools there. We are finishing it up the next 2 days, and they should be available to you at no cost on the ELNIC website.
Just out of interest, are retired nursing helping in the pandemic? Can you speak to the nurses helping that are coming out of retirement?
I've heard stories of many nurses coming out of retirement. Certainly the state boards of nursing have, because this is a pandemic and a crisis, nurses are being allowed to practice in states that they may not have a license in if necessary. I don't have information specifically about what all the retired nurses are doing. I know many of them volunteer in their communities to help with elders who might be lonely and stranded, and to do things of that nature. But I don't know specifically what they might be doing at many of the institutions. As we know, many hospital systems have asked that volunteers not come into the system anymore. They've been a huge support to the systems, but because they are limiting visitors and the public from coming in and out of those places, we are seeing less help from them. So I don't know specifically what the retired nurses are doing, but I would ask if there's someone out there who is starting something up, please share it with Sigma, and we'll get it posted on our, on website so that it's known to other retired nurses who want to join in and help in this difficult time.
Polly, I do have a few more questions coming in, but I would like to ask the audience to please post which country you're from. Polly, a question for you. How can we ethically justify keeping persons away from their dying loved ones?
That is just heartbreaking. I know many institutions are allowing, if the patient is actively dying, to have at least one family member in the room, but many are not. And it's what's going to cause probably the most moral distress for so many of us. If you can creatively find ways to help the patient and the family feel connected, whether it's using iPads, having family members bring in lots of pictures, special items from home, anything that you can put in the room to give the person comfort, special music that might help them remember family and friends, etc. I would encourage you to do that, but it's really going to be difficult when, again, the interest of the public is such that may be really restricting us from allowing family to be at the bedside. And what we're going to see from a result of this is very complicated grief on the part of families, and also grief on the part of the healthcare workers, and in particular the nurses.
How do we reassure our families regarding our duty to care for others?
How do we reassure families? I'm not sure that I totally understand the question. I'm sorry. Certainly, and maybe go ahead.
I think they're trying to say, as nurses, we're on the front lines, but how do we go home and reassure our families that this is what we're being called to do, as well as this is where we need to be, and so our time needs to be there and both at home. Does that make sense, Polly?
Yes. So that gets to the balance of making sure that you find, time for you and your family when you are home. So when you leave work, that you're able to keep your family healthy by, certainly having followed the CDC guidelines for, gowning and gloving, et cetera, all during the time that you're there, possibly, depending on how great your exposure is, showering before you come home, or certainly as soon as you do get in there. And then I think it's an opportunity to teach your family, especially, your children, if you have children, about what you do as a nurse and what you're called to do, and help them understand the power of this amazing profession, and what a hero you are for doing this work.
Polly, how can nurses who have been trained in mass casualty triage cope with the life-changing decisions they are being called to do?
That's certainly, it's almost like a battlefield. We're making decisions about who might live and who might not, because of the technology issues and the concerns about the numbers of ventilators, especially in New York and Washington State and California, and the needs there. I think that all we can do is tell ourselves that we are here to provide care, and care to every single person. It is not specifically about the technology that we're providing, but that are always caring for patients, even if we're not doing some of the life-saving measures that maybe we're accustomed to when we're in that mode, in trauma, etc. I don't think we always remember the power of our presence and how much we do for patients who may not be able to survive this, in terms of comforting them in their final hours. I think that is noble, and not everyone will be able to survive this crisis, this pandemic, but everyone will be able to get great nursing care. And you have to go home at night knowing you've done that.
Okay, Polly, I have one last question. What do you recommend for nurses who have been told they will not receive N95s and are expected to see positive patients with surgical masks? How do we handle this from a moral stance?
That is unacceptable. I think this is a time to step up as a leader and to go to administration and recognize that this is not safe practice and that something has to be done. Now, if this person who's asking the question is from in the New York City area where there are limits, I can appreciate that that is ever more challenging. But those who are at other institutions who maybe there's some issues about saving the masks for later or whatever, I would encourage you to be a leader and talk to your supervisor, go up the ladder to make it clear that you want to follow the CDC guidelines and to exhaust all possible resources available within your community to get those masks. I don't know that everybody remembers that there are other access places like dental offices, as I mentioned, and certainly schools of nursing if they're in your community, or other labs that might have them. Certainly take that leadership role to demand that the guidelines are followed, and then help with some creative strategies to source out those masks. It is all of our hope that in the next few days we are seeing that fear decrease as more and more masks are delivered.
Well, thank you so much, Polly, for this evening and for all this great information. Sigma is grateful that you took the time to share with this audience, and we look forward to hearing from you again. Again, I would like to ask the audience to please post which country or which state they are from, and I want to thank our audience for joining us. Have a wonderful evening.
Good night, all.